Later in this video, I'll tell you about a cancer doctor's clinical trial where none of the participants progressed to cancer after 12 weeks on a diet that had nothing to do with restriction or calorie counting. Stick around, because the reason it worked is not what you'd expect. Cancer patients get told, "Watch your diet," constantly, but rarely by anyone who's actually tested what that means with real clinical trials. This matters most if you or someone you know has a family history of blood cancers, or has ever been told they have a precursor condition that's not quite cancer yet, but could become it. Dr. Orvi Shah is a hematologist-oncologist at Memorial Sloan Kettering Cancer Center, specializing in multiple myeloma. She started studying diet and cancer after her own diagnosis with Hodgkin lymphoma, realizing, as a doctor, that she'd never actually been taught what patients should eat. The weight cancer link nobody talks about. Most people think of obesity as a heart health or diabetes issue, not a cancer one. Dr. Shah's research found that people with early precursor blood conditions, called MGUS or smoldering myeloma, who are overweight or obese, have twice the risk of progressing to full-blown cancer. That means a modifiable, everyday factor, body weight, is directly tied to whether a precancerous condition turns into an actual cancer diagnosis. The fix her research points toward? Addressing weight isn't just about how you feel day to day. It may directly affect long-term cancer risk if you're in a precursor state. The diet trial nobody expected to work this well. It sounds too simple. Eat more plants, don't count calories, see what happens. Dr. Shah's NUTRIVENTION trial had participants eat as much as they wanted, as long as it was whole, plant-based food: fruits, vegetables, nuts, seeds, whole grains, legumes, for 12 weeks with health coaching. Participants lost an average of 8% of their body weight, and their insulin resistance, inflammation, and gut microbiome health all improved. The fix? No fad, no restriction, just a shift toward whole plant foods, tested with the same rigor as a drug trial. The result that made her scale it up. Here's the surprising part. At the 1-year mark, none of the trial's participants had progressed to full multiple myeloma. That's not proof diet prevents cancer on its own. It's a small pilot study. But it was a strong enough signal that she's now running a much larger follow-up called NUTRIVENTION 3 with 150 participants. The consequence of ignoring this kind of research is missing an early, low-cost intervention that could matter most for people already at elevated risk. The fix? Watch for those larger results. This is actively being tested at a bigger scale right now. A cancer doctor took a question most physicians brush off, "Does diet matter?" and turned it into a real clinical trial. The result is meaningful weight loss, improved metabolic health, and zero progression to cancer over a year in a small, at-risk group. It's not a miracle cure. It's real evidence that a modifiable, everyday choice might matter more than most of us assume. Would you actually try a whole food, plant-based diet for 12 weeks if a doctor told you it could lower your risk? This video is for educational purposes and isn't personal medical advice, diagnosis, or treatment. Talk to a doctor or registered dietitian before making significant changes to your diet or health routine, especially if you have an existing condition or are at elevated cancer risk. If this surprised you, drop a like. It helps more people see real research instead of diet hype. Subscribe if you want more videos breaking down actual clinical trials, not wellness influencer claims. Next time, I'm covering the gut bacteria connection her lab found between diet and staying in remission. That one's even more surprising.